Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today, and I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging, and we want to help you be more successful. And today's guest is Steven Ramirez. He's the CISO at UofL Health. Welcome, Steven.
Glad to be here.
Yeah, so I'm excited to have a CISO on the CIO podcast. I think it's important to have a number of different perspectives, and I think you offer some really interesting perspectives. And I need to give a shout out too to Lindy Barham from Simplicity Inc. She connected us and was able to help bring you on the show. So excited to have you here. For those not familiar with you or UofL Health, can you tell us a little bit about yourself and your organization?
Yeah. Again, my name's Steven Ramirez, and I'm the CISO at UofL Health. UofL Health is a regional academic medical center. We have 9 total sites, 5 total hospitals with some freestanding medical centers, and have roughly 12,500 users and growing. Definitely have our trauma one, our transplant center, and a pretty big regional footprint. So, important member in the community, especially with everything going on with COVID. So we've had a lot of our major testing and vaccination sites throughout the region. So.
Yeah, I heard CISOs aren't allowed to call them users anymore. They call them points of failure or points of risk. Yeah, 12,500 points of vulnerability you have to deal with. That's a challenging job. I think one of the challenges many CISOs face and even organizations face is how do you get the support for the security efforts you want to do from either the CIO or maybe more importantly now, the board. I'd love to hear any thoughts you have on what have you used that you've been, found success in being able to get that support for your security efforts?
Well, I think over the past year that the dynamics changed for sure, with ransomware being almost on the front page every day, every week, especially in healthcare. But it's really about selling the risk and really that it is a business associated decision point a lot of the times. And typically IT securities fallen under the IT umbrella, but again that we've seen that really siloed approach really isn't as successful, and really having that relationship and kind of cultural build into the organization on working with the clinical and the business side of the house. So most importantly, I know it's important to have a good relationship with the CIO. I know a lot of CISOs do have different reporting structures. It's most common to probably have them report into the CIO, but we're seeing that change a little bit across the landscape and going into legal, chief risk officer, and other associated pieces, just based on the specific organization. But really key is painting risk and really showing the financial, patient care, and operational impact. So showing some quantitative numbers associated with that we're now seeing that it's $47,000 an hour for a ransomware attack. On that. So, being able to show that and to really show that ROI on the tools and investments that we're putting in place, not only to cover us from a reputational, patient care and a revenue protection standpoint, but also to really, ensure that we're delivering the care to our patients. That again, we're so dependent on technology across the board in healthcare now, especially at academic medical centers, that we're trying to be more tip of the spear on what we're able to really get into and, really enhance the overall research and, in turn, some creative patient care methodologies. So again, really painting the picture, being very clear and concise on, what the technical risks are, and then how that transponds and trickles down into overall clinical and business risk. So I've always been a big, outside of the red, green, yellow stoplight,
Okay.
out in the market, really going through and really showing quantitative numbers. If this event happens, this is what our impact will be from a financial, patient care, operational, and then, really showing the safeguards that we have in place to really show maturity, and then what we're doing to combat that risk across the board. So again, knowing your audience, talking to my CIO, that's a lot easier. That, she obviously understands technical components and the big picture. But if you're speaking to the board, of course, you have to boil that down into really, more numbers and impact to the overall organization. So again, being able to be very targeted and crisp on what our current risk is, they like to know like our overall rating on an ABC scale, and then numbers to associate with that. So that's really where we've gone on that. Being an academic medical center, of course, happy to use grades like they would in college. So that's really our approach on that.
That makes sense. I love that description, painting the risk for them. That's a really a good way to describe it. But I think the challenge is that, every organization has limited resources. And so I think you have to end up prioritizing things. But are there some areas of security at healthcare organizations that you think people maybe aren't putting enough emphasis on, that has you maybe worried for those organizations, or maybe even for yourself, but you can talk about other organizations better.
Yeah. Yeah, you can't mitigate all risk. You've got to understand that you can't ever not have zero risk in organizations. So that's really the importance of, the first part of your question on prioritizing risk. So really being able to go through and see what you're most vulnerable as an organization. And then that helps what compensating controls you put in, from a people, process, technology standpoint. So I still think across the industry, we're still seeing that multi-factor authentication, 2FA, is still not used as much as it should be. That's one of the, more low-hanging fruits across the board to really ensuring that you do have a, secure perimeter and, proper access management that, when I was on the consulting side, I saw it. And even, being in this role and talking to some of my peers across the board, that we're seeing a lot of these attacks as of late, as it relates to ransomware, are, one of the after action findings was that, MFA was not implemented as part of that, because we know it is a disruptor, especially on the clinical side. So again, that goes back to what I said from a cultural standpoint, really having that top-down approach, selling the importance of components like that. Good password hygiene and multi-factor authentication, two of the most basic things you can have that are really low cost, high reward, still are something that we need to do better as a security profession across the board, not only in healthcare, but in other industry that we've seen.
So why do you think it hasn't been implemented? Is it really that whole, at least perceived and sometimes real, depending on how it's implemented, impact on the user experience that, it's harder to log in and I have to log in 50 times, so I don't want to do multi-factor? Is that what's holding it back, or do you think there's something else going on?
It's also that in healthcare, we have providers. So it's always about, interrupting another click, another tool they need to download. So it's always taking in the dynamic of having to work with them that, especially in a trauma one and, a lot more stuff that we're seeing, that is something that they have to do if they're not used to doing it as part of their culture and, or, being sold on the value that that's adding to the overall organization. That's a change to a deviation from what they're used to doing. So again, that's part of some of the biggest pushback you'll always see when you're implementing security controls, is making sure you have clinical buy-in, because again, that's where it can be most impactful. And I think that's why across the board that it's just either too political and or it's a big effort to do that, especially with a lot of organizations going across and buying up practices to really expand their care capability, really looking to get more into the that patient care community health model. Again, the more providers you get, you're having to bring them in, change their normal day-to-day operations into that. So I think that that's a lot of it too. It's really just the impact and people not wanting to be as big of disruptors, thinking that there's other things that they can focus on. But if we've seen time and time again that is still one of the most effective security mechanisms you can put in place. So it's, again, I like to always say security 101, starting with the basics, password, multi-factor, and then, building out your adaptive defense in depth associated with that. So.
Yeah, I mean, it's such a great point. When you acquire a practice, you're asking them to change so many things, and so you try to cut stuff down on that. So that okay, what should we want to focus on first? Because there is such a cultural shift, and I think that type of security stuff could get axed pretty easily.
And these things, so we know that the importance of, especially in COVID now, remote work, and then being able to have that interoperability with personal devices. BYOD, bring your own device. That again, really shows the importance of having multi-factor authentication put in, because again, we're able to manage and protect a lot of our tools, a lot of things that we have visibility into. So that's why really the importance of as we're expanding on that, really looking to improve the overall care footprint and usability, that's again why it's so important to have basic components like that. And again, COVID introduced new risk by sending people home. And then, as we're going through and, looking at drive-through vaccination sites, testing sites, that's a lot more of moving your typical brick and mortar out, more into the community on setting up tents, doing other pieces like that. So that's a whole nother dynamic that you have to make sure you're securing new devices and new risks that, is brought in as you're looking at that. So.
Yeah. And I think that's the other interesting challenge is, you have limited resources as we talked about. And so how do you, with limited, time, money, et cetera, how do you balance kind of having a desire for this continuous assessment of the IT security practices that you do, but also of the risks? And as you mentioned, those risks are constantly changing. So how do you approach that to make sure there's a good balance of continuously doing it, but you can't do everything?
Well, I like to implement a hybrid approach, and that's also part of me being, I always like to say on the dark side. I was a former vendor working with S&N IBM, so really seeing that whole other side. And what really works well, that we're seeing that there's a shortage across the board in security talent, and a lot with, what COVID has introduced, that a lot more organizations that typically weren't remote are now opening that up. So that's a lot more opportunity. So it makes the healthcare IT, which might not have as high paying of, positions, as well as also, ability to work in, Facebook or somebody out on the West Coast that's fully remote now, or Google and all those others. So we have to compete with them as well. But again, it's prioritizing risk and then, really having that hybrid methodology that, where does it make sense to have managed services? That there are some great managed service providers out there. So if they're, you're having, a newer organization, like when I came in, we were in the middle of an acquisition, that it made sense to really scale components of that while we were building out our internal processes to really have that hybrid of, our on-site people, but also the technology side that was also able to give us an uplift in our maturity right off the bat by having managed services come in to really help us get to my desired state a little bit quicker than trying to go through and, build all of those components out internally. So prioritizing risk, putting in compensating controls, from a process standpoint, and then, being able to allocate funding. Because again, that's always, one of the bigger budgets. You can budget constraints that you can spend $1 billion and still, be a victim to ransomware or something like that. Because you got to not only be tactical, you have to be strategic in what you're doing to, again, your point, to review risk, that it is a continual thing. That I like to really have an all hazard approach. Looking at the old emergency management perspective, that you don't want to just plan for one risk. You want to really build your defenses into, being able to mitigate a multitude of risks that, it could be ransomware today and it can be something else tomorrow. But a lot of those pieces do go back to what we had talked about earlier on really having your fundamentals and security 101 in place, that, having good passwords, having, two-factor authentication, having good detection tools, having that hybrid approach, working with strategic and tactical vendors to really help your organization as part of that. Because again, we're always going to have risk, especially in a healthcare environment. So it's about managing risk to a point that it meets our threshold, and that's something that we're able to, again, be able to go to sleep at night. That we're managing risk to a point that, that we are comfortable with, and that we feel like we have a good grasp on and can handle as an IT team.
Yeah, it's such an interesting perspective to think, with a lot of IT projects, you spend $1 million or 100 million or $1 billion or whatever, on the project, and you achieve the goal, which is more efficiency and documentation and legal compliance. And you can feel really satisfied that you did a great job. But with security, you could spend $1 billion and then, someone clicks the wrong malware and all that $1 billion, I think comes into question, which, I say, it's one of those challenging aspects, I think, for a leadership, is to understand that you mitigated risk, but that there still is potential for it. And I guess maybe it's hard for them to see that, hey, I blocked 10,000 breaches, even though one got through, right?
Yeah, it's always the one. And it's always human behavior, and we're seeing more third-party risk because there's a lot of things that you can control.
Yeah.
But again, that's where you have to put in good practice and that continual training and awareness that we know that our end users or endpoints, as we rebranded them in the beginning of this, that it is important that it is continual, and to show them more targeted training and look for areas of improvement to really show them how recent events could impact our organization. So to really make it real instead of that checkbox training that we usually do, we like to do a lot of hands-on training, going out and doing that and saying that really you're our front line of defense, but also on the other end are potential first line of risk. So it's like a double-edged sword on that side of the house. So it is that dynamic of continual training, putting in processes and controls to really ensure that we're mitigating end user error and continuing to train and see creative ways that we can help mitigate risk. So
yeah, great way to describe it. So what's something a CIO doesn't know about security that maybe they should know?
If you would ask me that maybe a year ago, I think I would have had a different answer than today. I feel like that is top of mind of almost every CIO, to the point that I am now next door to my CIO, that, she's right across my wall. Now we have the bat phone, if she has any questions. But no, I think that, the CIO is more the, jack of all trades. They have to understand the full environment and ecosystem of an IT environment. And that's really where us as the security professionals give them all of the intel and wherewithal that they need to be able to make those strategic decisions associated with that. So again, I think the dynamic has changed, that they're a lot more security conscious from where they were a year ago and even 3 years ago associated with that. But I think a lot more on the security operations, because it's, again, I think it's that question's dependent on where the CIO came from. If it's we're seeing a lot more CISOs and CTOs rolling into that. So, people with a stronger technology background, probably understand a lot more of the fundamentals versus somebody that's maybe, like a clinical application or, a COO. So really understanding their background would really help drive, areas that they might, be more dependent on their CISO to help educate them on. But I think, having that 10,000 foot view and having that level of trust and collaboration, is key to that, because I'll never know all components of that. But I think, security operations and really understanding the risk landscape is, one of the things that it's ever changing, that's just one part of overall IT operations, that's probably something that a lot of them probably are getting a lot more attuned to nowadays on, making sure they stay up on that. But I think that is top of mind of a lot of CIOs right now, especially in healthcare. So
yeah, that's true. So I think one of the challenges is you kind of mentioned at the end there was, how do you stay up to date with the latest, security technology approaches, or even the next generation solutions, or even the opportunities to outsource to some managed service providers? Like, what do you do to stay up to date on kind of the latest solutions and approaches for security?
And I think COVID's definitely changed that, but really doing research, going to collaborative events like, my local ISACA, HIMSS, there's a lot of good resources out there. I know CISA, LinkedIn, believe it or not, is a great resource for seeing emerging technologies. There's a lot of CISO advisory boards and that. So again, in healthcare and different pieces that, a lot of people, it's more competitive, but we've always seen, and, a lot of my other CISO colleagues would agree that it's not anything of a competitive component to security. So I know that every CISO I've met is always, willing to share war stories, some lessons learned on practices that you could always call and say, what did you think about this tool? What were some pain points to that? So really having the CISO group is like a brotherhood in that they're all willing to help one another. It's like a, small fraternity. Anywhere you go, that, you do the fist bump and, the head nod to that side of the house. But I think it is on, leaning on groups like that, doing your research and also having strong vendor and channel partners associated with that. Because again, I like to always look at it from, detection, containment, response, and eradication. So when I have my key buckets, I can see who the top players are in that, with detection being the key critical component to that. So again, I like to really set the stage of what I want to do and set the thresholds for me to be able to do that, and then see what vendor then aligns in that, and doing POCs, doing reference checks, doing all those other pieces to really see what makes the most sense. And then also from, lessons learned. That's, part of what we've seen out on a lot of these organizations hit with ransomware and other, security and cyber attacks. There's a lot of lessons learned that come out as part of that. And going through and looking at what they didn't have in place and then what they put in place since then to really, gauge yourself against that. And again, that's where you can use your managed service providers, a lot of your tactical vendors that you work with to really ensure that that this happened to this organization. Now, what do we have in place to compare to that and see what any gaps are? So that's part of, to your point, that continual risk assessment and really making sure that your security posture is very adaptive. So that's why I like to use the word adaptive defense in depth, that whatever we have is able to, bend, not break, to really align to the overall situation. So,
yeah. I think it's interesting. You mentioned LinkedIn. I've heard lots of mixed reviews. Is that in the groups or just from the network of people you've connected to, or where do you see the real value there?
I think it's a mix, because again, that is, if somebody finds a good article, they'll put it on. And again,
right.
I don't necessarily think it's all like vendors, but it's like, fellow CISOs, CIOs,
Sure.
people in the industry, but there are those private groups associated with that too. So that's, a lot of people go to Facebook for news. LinkedIn's also, just a good way to get something that you want to go research or have some, probing questions to go through and, start asking your network on. So it's almost like real-time pieces that you'll see that there before you see it in, the Wall Street Journal or something like that.
Sure.
So it's just a way more thought-provoking, or, to really just stay up on emerging technologies and or risk. So.
Yeah, I love it too. I mean, you have to learn to ignore the sales message from a few people, but other than that, there's a lot of value there.
There's a lot of noise, but yeah, that's also, having that, there is some good content on that. So I think it's a good collaboration site. So.
Well, it's all about the network you created. So that's great. It's interesting. You used a couple of phrases that were interesting to me. And actually, one of the female CIOs that I had on the podcast previously, she kind of challenged me to do this. So you get to be first for this question. But, you described it as a brotherhood and a fraternity. And I love the idea, right? Now, I don't think you were trying to be gender specific, although it is interesting that the majority of CISOs are men. Any thoughts on how we could be more inclusive of women and what else needs to be done so that more women are involved in healthcare security and eventually CISOs?
Well, I can say that one of my first jobs in healthcare security and risk, my whole leadership up the chain, I had a female CISO. So, and then my director.
You have a female CIO right now, which
yes, and I do too. So I think that it is, yeah. So, I've always been, around that, and I think there's a lot more opportunities to that. But to your point, it has been a lot more, I guess, male dominated in the sense that, security typically had, that tie into like physical security. So I think that whole dynamic has changed, and it's become more of a business facing and critical, role within the organization, and where the CISO role and responsibilities were, 5 years ago to where they are today, I think that we're going to see a lot more women in that. I have a lot of, friends that are, that I've come in, close contact with that are, some great leaders that do that. So I think that we're going to continue to see a lot more across the board associated with that. And I know there's a lot more focus on that because, some of the brightest minds that I've worked with, and some of the, I won't name any of the organizations by name, but there's some definite people out on the West Coast that I've called to, get, squeeze their brain on stuff. And again, that's, that is part of the overall fraternity of that, regardless of, male, female, that I think that a lot of women are more than capable and probably would do a lot better than I would at this role. I mean, my CIO is amazing. And, I think that paradigm shift is going to definitely turn to seeing a lot more moving forward. So.
Yeah. Well, and we've seen that shift a lot. I think you see, I mean, you still see the good and the bad at events like DEF CON and, Black Hat, where more and more women are, participating. But we also, I think, in many cases, it's not a very welcoming environment for them. So, anyway, it's a challenging discussion, but I think it's an important one for us to have. So thanks for taking part in that. As we wrap up, let's finish off with a little career advice. As you look at your career, what's been the best piece of advice that you've been given?
Well, that was definitely when I had first started that one of my CISOs and leaders both had consulting backgrounds. So they had always said the best way to really understand what a best practice is, have that holistic view of what's going on in the industry, is to really, step into that world for a little bit. Because again, you're, as a consultant, you're seeing, different organizations, seeing different vantage points, seeing different risks, seeing different processes on how people are addressing risk and security across the board. So versus, a lot of leaders that, have been in the same role for, at the same organization for a while, they might have, blinders on or only used to the way they're doing things. So that really gives you that more holistic view and vantage point to do that. So that was very, one of the best subsets of advice I did. I took advantage of that and went out into the consulting and vendor sphere, and then came back to the hospital side. So I think that really helped me understand not only risk and seeing other things out in the market, but that also helps you to what we had just discussed earlier, that being a CISO, you have to be able to present to senior leaders, present to the board, to really be that salesperson, to really justify what you're doing and really be able to paint that picture based on the audience you're speaking to. In healthcare, you have business, you have clinical, and of course your technical groups. So again, really having that more polished and presentation skill set that you do get being on the consulting side. Really now, going back and thinking about that advice they had given me, I can really see how that all made sense to being a more well-rounded CISO as a part of that. So I think that was some of the best advice, and continue to learn too. It's and don't be scared to say you don't know, and work with. That's why you have your CTOs, your technology guys, your clinical application people, that you can't know everything. You just need to be strong at what you know, and be able to then bake in practices to what they have. So, be humble and be willing to, have an open ear to how you can align to, practices to make the organization more secure. That the old typical security was always no. So now it needs how can we to really look at how you can be more adaptive, how you can align better, and come to some kind of compromise. There's always something you can compromise in, especially in healthcare. You need to, because it's our job to ultimately provide quality patient care across the board. So we want to be good stewards and support services to our clinical teams to really ensure they can do their job, but also ensure we're protecting the organization.
Yeah, great advice. Be humble and collaborative. I really love that. Well, thanks so much, Steven. This was a lot of fun, and I think you shared some really interesting and important insights. As you mentioned, I think security is top of mind for people, keeping them up at night if they're not ready, and just always nervous about the next ransomware attack or whatever might come. So thanks so much for sharing, and thanks everyone for watching. If you want to find more great healthcare IT content like this and the rest of the CIO podcasts in the series, be sure to check it out at healthcareittoday.com. Thanks, Steven.
Thank you.